Every year, worldwide, about 42 million women with unintended pregnancies choose abortion. Here, the expression unintended pregnancies can include women and children who have been victims of rape, and children who suffered the abuse of incest and become pregnant by a family member. Nearly half of these procedures, 20 million, are unsafe. Some 68,000 women die of unsafe abortions annually, making it one of the leading causes of maternal mortality. 13% of maternal mortalities result from unsafe abortions. An unsafe abortion is defined as, quote, a procedure for terminating an unintended pregnancy, including those pregnancies that resulted from rape or incest, carried out either by persons lacking the necessary skills or in an environment that does not conform to minimal medical standards, or both. Obviously, in the absence of legal, clinical, medical abortions here in the United States, these procedures, where such procedures are not available under the terms and conditions of the law, will all fall under the category of unsafe abortions. Of the women who survive unsafe abortions, 5 million will suffer long-term health complications. Both of the primary methods for preventing unsafe abortions, 1, less restrictive abortion laws, and 2, greater contraceptive use, face social, religious, and political obstacles, particularly in developing nations where most unsafe abortions, 97%, occur. In light of the recent decision made on the part of Supreme Court justices regarding the reversal of the decision involved in the case Roe v. Wade, the United States effectively has become a developing nation. Even where these obstacles, determined by social, religious, and political ideologies and configurations, are overcome, women and healthcare providers need to be educated about contraception and the availability of legal and safe abortion. And women need better access to safe abortion and post-abortion services. Otherwise, desperate women facing the financial burdens and social stigma of unintended pregnancy and believing they have no other option will continue to risk their lives by undergoing unsafe abortions. According to the World Health Organization, every 8 minutes a woman in a developing nation will die of complications arising from an unsafe abortion. It is reasonable to assume that now, in the United States, a nation formerly considered one of the developed nations because of recent decisions made on the part of the Supreme Court overturning a woman's right to a safe abortion within the boundaries of the United States. It is reasonable to assume that within the United States, a similar proportion of women will die of complications arising from unsafe abortions as those who now die of complications arising from unsafe abortions in developing nations. For this reason, we can no longer consider the United States, at least in terms of health care available for women, to belong to that set referred to as developing nations. An unsafe abortion is defined as a procedure for terminating an unintended pregnancy carried out either by persons lacking the necessary skills or in an environment that does not conform to minimal medical standards, or both. The reason that the United States will see an increase in unsafe abortions is simply because those procedures for terminating an unintended pregnancy, which can be carried out by those possessed of the necessary skills or an environment that does conform to minimal medical standards, that those positions have now become, in many states, illegal, and those procedures have become, in many states, illegal and can be prosecuted under the law. The fifth United Nations Millennial Development Goal recommends a 75% reduction in maternal mortality by 2015. World Health Organization deems unsafe abortion one of the easiest preventable causes of maternal mortality and a staggering public health issue. Of course, in order to be preventable, safe abortions would have to be legal. It's unlikely that those individuals within the medical establishment capable of carrying out the procedure and possessing the necessary skills and possessing access to an environment that does conform to minimal medical standards will continue to practice those procedures if they are aware that their actions can be convicted under the law. Obtaining accurate data for abortions is challenging, and especially so for unsafe abortion. 2/3 of nations do not have the capacity to collect data, and data collection varies from country to country in both quantity and quality. In the United States, there's a technical capacity for the collection of data, and yet what we have seen in the past few years is such an abundance of propaganda and misinformation produced by the media, particularly the alt-right media, that data collection suffers in what was once considered the developing country of the United States in both quality and quantity, at least as significantly as it has suffered in underdeveloped nations. Ideology has become a key factor in quantifying and qualifying data related not only to the statistics and accuracy of reports involving unsafe abortion procedures, but in medical health in the United States overall. Because unsafe abortion is often done clandestinely by untrained individuals or by the pregnant women themselves, much of it goes undocumented. Figures are therefore always estimates. Data suggests that even as the overall abortion rate has declined, the proportion of unsafe abortion is on the rise, especially in developing nations. It is reasonable to assume that, given the recent decisions made by the United States Supreme Court, unsafe abortions will be on the rise in the United States as well, contributing to its redefinition as an undeveloped nation. From 1995 to 2003, the overall number of abortions declined, but the unsafe abortion rate was steady, from 15 to 14 abortions per 1,000 women, respectively, constituting an increase from 44% to 48%. In Western nations, now excluding the United States, only 3% of abortions are unsafe, whereas in developing nations, now including the United States, 55% are unsafe. The highest incidences of abortions that are unsafe occur in Latin America, Africa, Southeast Asia, and, one can only estimate, but estimating now, the United States. Even safe abortion in developing nations, now including the United States, carries risks that depend on the health facility, the skill of the provider, and the gestational age of the fetus. With unsafe abortion, as will occur now in the United States, the additional risks of maternity, morbidity, and mortality depend on what method of abortion is utilized, as well as women's readiness to seek post-abortion care, the quality of the facility they reach, and the qualifications and tolerance of the health provider. Methods of unsafe abortion include the following: drinking toxic fluids such as turpentine, bleach, or drinkable concoctions mixed with livestock manure. Inflicting direct injury to the vagina or elsewhere, for example, inserting herbal preparations into the vagina or cervix. Placing a foreign body, such as a twig, coat hanger, or chicken bone into the uterus. Placing inappropriate medication into the vagina or rectum. Unskilled providers also improperly perform dilation and curettage in unhygienic settings, causing uterine perforations and infections. Methods of external injury are also used, such as jumping from the top of the stairs or a roof or inflicting blunt trauma to the abdomen. Presumably, following the decision made on the part of the members of the Supreme Court in the United States regarding the reversal of Roe v. Wade, all of these methods, which shall be repeated here, will increase in the United States. Those methods, once again, include the drinking of toxic fluids such as turpentine, bleach, or other concoctions mixed with livestock manure, inflicting direct injury to the vagina or elsewhere, inserting herbal preparations into the vagina or cervix, placing a foreign body such as a twig, coat hanger, or chicken bone into the uterus, placing inappropriate medication into the vagina or rectum, performing dilation in unhygienic settings, causing uterine perforations and infections, and a variety of other methods such as jumping from the top of the stairs or a roof, or inflicting blunt trauma to the abdomen. Worldwide, some 5 million women are hospitalized each year for treatment of abortion-related complications such as hemorrhage and sepsis, and abortion-related deaths leave 220,000 children motherless. These motherless children are not provided provisions under the current laws or Supreme Court decisions made in places such as the United States. The main causes of death from unsafe abortion are hemorrhage, infection, sepsis, genital trauma, and necrotic bowel. Data on non-fatal long-term health complications are poor, but those documented include poor wound healing, infertility, consequences of internal organ injury, urinary and stool incontinence from vesiciovaginal or rectovaginal fistulas, and bowel resections. Other unmeasurable consequences of unsafe abortion include loss of productivity and psychological damage. The burden of unsafe abortion lies not only with the women and families, but also with the public health care system. Every woman admitted for emergency post-abortion care may require blood, products, antibiotics, anesthesia, operating rooms, and surgical specialists. The financial and logical impact of emergency care can overwhelm a healthcare system and can prevent attention to be administered to other patients. Obviously, in nations in which safe and legal abortions are banned, healthcare systems have no means of operating safely, sanitarily, and administering to the needs of their patients. Abortion laws have a spectrum of restrictiveness. Nations may allow abortions based on saving the mother's life, preserving physical and mental health, and socioeconomic grounds, or may be completely unrestrictive. Data indicate an association between unsafe abortion and restrictive abortion laws. That is to say, that the more restrictive the abortion laws in any nation or state, the more women who die, become traumatized, or disabled as the result of unsafe abortions. The inference that we can make of this is that restrictive abortion laws harm women in direct proportion to the degree that these laws become restrictive. The median rate of unsafe abortions in the 82 countries with the most restrictive abortion laws is up to 23 of 1,000 women, compared to 2 of 1,000 in nations that allow abortions. That is to say, that in nations which restrict abortion laws, 23 of 1,000 women are harmed in comparison to nations in which abortions are allowed, in which 2 of 1,000 women suffer the results of abortions. Abortion-related deaths are more frequent in countries with more restrictive abortion laws, period. Abortion-related deaths are more frequent in countries with more restrictive abortion laws than in countries with less restrictive abortion laws. Abortion-related deaths are more frequent in countries like the United States with more restrictive abortion laws than in countries with less restrictive abortion laws. The same correlation appears when a given nation or state tightens or relaxes its abortion law. In Romania, for example, where abortion was available upon request until 1966, the abortion mortality ratio was 20 per 100,000 live births in 1960. New legal restrictions were imposed in 1966, and by 1989, the ratio reached 148 deaths per 100,000 live births. Within that period, the same number of procedures resulted in an increase of over 700% death. The restrictions were reversed in 1989, and within a year the ratio dropped to 68 of 100,000 live births. By 2002, it was as low as 9 deaths per 100,000 births. Similarly, in South Africa, after abortion became legal and available on request in 1997, abortion-related infection decreased by 52%, and the abortion mortality ratio from 1998 to 2001 dropped by 91% from its 1994 level. Less restrictive abortion laws do not appear to entail more abortions overall. Let me repeat that. Less restrictive abortion laws do not appear to entail more abortions overall. That is to say, and put in a different way, that laws restricting abortions seem to have no effect on the number of abortions that are actually procedurally made available to those individuals with unwanted pregnancy. Let me put this in another way. Restrictions and nations which restrict legally the procedure of abortion have no effect on the number of abortions that are actually provided. The number of abortions does not change whether the nation chooses to restrict abortion procedures in their law or to allow them. What does change is the number of deaths and injuries caused to women who receive abortions, which are illegal, unsafe, unhygienic, and dangerous to their lives. Let me say this in another way. Laws restricting abortions do not stop individuals from having abortions. They kill women. Let me say this another way. The recent laws and reversal of Roe versus Wade made by the Supreme Court will not change the number of abortions in the United States, but will change the number of lives of those women who survive abortions, because those abortions were carried out in safe and hygienic conditions and provided by trained and technically informed medical personnel. Let me say this another way. The recent decision made on the part of the Supreme Court will kill women. Let me say this another way. The recent decision made on the part of the U.S. Supreme Court will leave the children of those women that it kills, those women who have children already, but determined for economic or other reasons the necessity to have a procedure of abortion under unsafe conditions, those laws will change the number of orphaned children of women who are killed in the process of receiving abortions. The decision on the part of the Supreme Court, therefore, is one that will both result in the deaths of women, some of whom are already mothers, that will result in an increase in orphaned children, in an increase of trauma related to the fear and terror of those individuals whose unwanted pregnancies are unwanted because they're the result of rape or incest. And of course, no provisions are being made either for those orphan children or for augmentation of health care regarding those psychological traumas. The world's lowest abortion rates are in Europe, where abortion is legal and widely available, but contraceptive use is high. Let me repeat that in another way. Where abortion is legal, we actually see a lower rate of abortion than where abortion is illegal. Therefore, the correlation between legality and actual limitation of the procedure is reverse of what the Supreme Court ideology and the ideology of the right in the United States pretended to be. Let me repeat this. The world's lowest abortion rates are in Europe, where abortion is legal and widely available, but contraceptive use is high. In contrast, in Africa, Latin America, and the Caribbean, and now the underdeveloped nation of the United States, where abortion laws are the most restrictive and contraceptive use is lower, the rates range from mid-20s to 39% for every 1,000 women. Let me put this another way. The relationship between legality and number of abortions is the following. There are less abortions performed in those nations and states where abortions are legal and where contraceptive use is high and contraceptive education is part of the public education system. Let me put this another way. The best way of reducing the instances of abortion is not to make it illegal, but to provide sex education in schools, increase availability of contraceptives, and provide clinical and medical care in all instances of women's health, whether the pregnancy is wanted or unwanted. Let me put this another way. The only effect that this decision made on the part of the Supreme Court will have is the further destruction of human life, which is precisely and ironically what it claims to prevent.